Give me 1 second. Yeah, I think one of the key elements that we had already emphasized is the phlebotomy skill. What we have done is that understanding that this is the group of people who would always be working under the observation of a trained healthcare provider like a nurse or doctor. We try to kind of build a comprehensive aspect, what we call it as a 37 credits, which translates to 370 hours of learning. And we try to map it with the job roles that the Health Sector Skilling Council and NSTC have mapped with their program. So what you would also see there are two interesting things. Though we have mentioned eligibility class 10 and somewhere we have mentioned class 12, there are two aspects. We are looking at three types of engagement. One is that if there is an health worker with a civil society, they can be class 10 plus or a class 12 plus. This diploma would be one that would kind of give them the credentialing required to be more of a trained healthcare worker. But if someone is freshly planning to join as a frontline healthcare worker, we consider that with today's market and today's requirement, a class 12 is a much better for a youth because that also gives them to build on future courses. So that's where if someone is working already, has been kind of working for a long time, the class 10 eligibility comes in. But if someone is very fresh and wants to shift to the healthcare as a kind of career with the frontline worker being the first step, the class 12th was what we have added. We also have rural micro entrepreneurship options where irrespective of the learnings, they can get the diploma with the help of civil societies that are working across the areas who are partnering with us, and then they can liaison with the local labs, with the local doctors who can they can do the home health or outreach for them. So there are three models which we how we expect and we can work with the partners. One is obviously what Dwara's efforts have been like sponsoring the training of existing healthcare workforce. That's the plan with 30,000 rupees per participant for certification, which includes IHMR training them, certifying, along with access to the all the curriculum, LMS, and this thing. While the civil society or the CSOs are working, they support in terms of nominating a doctor who will oversee this, or any kind of senior nurse who can supervise this thing, support in Viva and field oversight. There's another option which I think we have been kind of talking with some of the partners, where the fresh graduates who are 12 pass would be kind of trained to the program. Same structure, but these are the fresher people who are newly entering the health system rather than the early. IHMR will deliver training, certification, and entire curriculum with the LMS and AI. While the CSO will kind of look at in terms of how to coordinate the field and maybe support the placements for them. That's for the livelihoods aspect. And third is when if there are some organizations who are already doing this training and they feel that the training is sufficient, but they need to certify the frontline workers. And that's where I think IHMR will work with those organizations to see how to align this thing with the IHMR structure, like 370 hours, 37 credits, along with access to the LMS and kind of support in the certification. And that's where we are also looking